Should I go ahead, Jignesh?
Yes, ma'am, you can start now.
So, good afternoon, everyone, and a very warm welcome to yet another empowering edition of the Vibe Live, a Hexalog. The Vibe that stands for Women Inspire, Build, and Enhance is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialities to share knowledge, leadership experiences, and personal journeys that inspire growth and collaboration. There are four fundamental pillars that form the vibe, which are physical well being, mental health, financial wisdom, and professional excellence. Through various initiatives, the vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in the western suburbs of Mumbai. I have a unique diverse background with a decade and a half spent in pharma industry and now since last half a decade in clinical practice practicing diabetes, thyroid and obesity. Besides clinical practice, I also contribute to research and medical writing as a co-founder of RFET. But what brings me the most pleasure in sharing is the introduction of this exclusive platform, The Vibe, as a founder of one of its kind that targets fostering women excellence. I'm blessed to be complimented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a 3-year daughter. With that, let me introduce you to our team, Vibe. Dr. Rukaya.
Hello. So I'm Dr. Rukia Suryashe. I'm a diabetes, thyroid, and obesity specialist. I've been practicing in Mulund for the last 15 years. And over these years, I've had the privilege of walking alongside my patients through their health journeys. And I must say, managing their sugar levels have sometimes it feels easier than managing their stress levels. So when I'm not consulting, you'll probably find me working out, playing carom, or just laughing over good conversations and great company. And recently, I have started this painting, which I enjoy every week that I do, and I share with my friends. That just helps me to bring some balance in this chaos. So, and I also believe that wellness isn't just about numbers and hormones, it's about the balance, the connection, and the joy. And I'm really looking forward for today's session for one of my husband's mentor, Dr. Asha Kapadia. And I would like now Dr. Lotika to introduce herself.
Good afternoon, madam, and good afternoon to our viewers. I am Dr. Lotika Purohit, a diabetologist and a lifestyle medicine physician practicing in Colaba since the last 3 decades. Besides that, I am also visiting faculty with the JJ Group of Hospitals and the Grant Government Medical College. I am a Rotarian. I have been the past president of my Rotary Club of Bombay Midtown, and also I am a parent to an artist and an entrepreneur. My husband is Dr. Suresh Purohit, who's more popularly known as the Sugar Doctor. And besides this, I enjoy traveling and eating healthy food. That seems to be the latest thing that I enjoy doing now. Besides that, what gives me real happiness is that I'm able to control people's metabolic parameters and see to it that they lead a good quality of life. Now I hand over to Dr. Kavita Rane for her introduction.
Thank you, Dr. Latika. Namaskar, everyone. I'm Dr. Kavita Rane. I have 15 years of experience in cardio diabetes and obesity. I practice at Chembur at Rane Hospital, Apollo Spectra, and Inlax Charitable Hospital here in Chembur. How this journey started was because of the issues that my grandparents used to have with diabetes, and I decided and promised myself that I wouldn't let my parents suffer. Is how I've become a diabetologist. In other news, of my own life is I have learned a lot from art, and abstract art is what I love to do. I love traveling, I love photography. I've had my own exhibition at Jahangir, and I love to be a part of this amazing group of women diabetologists. Over to Dr. Pranjali.
Thank you, Kavita, and good afternoon, everyone. Good afternoon, ma'am. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at Diabetes Clinic. It's in Mulund. I also take care of internal operations of our eye heal, which is eye unit, eye heal complete vision care. And I love treating young diabetics, help them live longer and stronger. But if you don't find me in my clinic, you will see me most of the time on weekends farming. I was a state level player, badminton player, so you will find me on the court playing with my boys and hiking. So that's the moment where I feel joyful, and I love interacting with mentors, teachers, and being part of this wonderful group. Over to you, Dr. Ritu.
So, thank you so much. With that, I'm sure you all can already see our guest speaker today. As you all know, today is World Cancer Day, the 4th February of 2026. And it is indeed an extreme privilege and honor to be able to bring you someone to the Vibe Life who has 5 decades of leadership within this space. Thank you so much, ma'am, Dr. Asha Kapadia, for accepting our invite for being here on the Vibe Life today. A quick intro talking about cancer is the one of the most dreaded diagnosis one can hear. In most cases, it sounds like the end of the world for the person as well as their family. But here is a branch that deals with these scenarios day and night. And here is the woman in spotlight today on World Cancer Day, who has been instrumental in transforming the lives of patients as well as their families with cancer, providing them excellent care combined with thorough compassion. Welcome, ma'am, a mentor, a doctor, a leader, a teacher, a perfect role model to the Vibe Life Hexalog. May I take the permission to introduce ma'am? She's been the past head oncology and head department of medicine at PD Hinduja National Hospital. She's been attached to the PD Hinduja National Hospital and Medical Research Center, where she's developed from very inception a state-of-the-art oncology department, introducing several pioneering techniques for cancer care. In mid-70s, she worked on cancer cell research in T cells and role of immunology in cancer with famous Lasker Award winner Dr. Robert Good at Memorial Sloan Kettering Cancer Center, New York, USA, where she became a youngest faculty member of most prestigious cancer center of the world. Since her return to India in the 80s, she continues to be a major inspiring force in the medical oncology field and has been a mentor to various students. She's been the founder of Mumbai Oncology Society, ex-president of Indian Menopause Society, has various publications in national and international journals, and has a list of awards, quoting a few, to be the Charak Award in 2010, the Lifetime Achievement Award 2023, and the Lifetime Achievement Award 2024 to 2025 by the Indian Menopause Society, by Indian Menopause Society in India. And of course, the Lifetime Achievement Award in December 25 as well, which honors her dedication to the fields of oncology and hematology by the MOC Cancer Care and Research Center. Madam, a very warm welcome to you once again. And may I just have quick words from you of how did you feel when you were invited for this platform?
Hi, it's lovely to see you all. When I heard the word vibe, wow, it just made me feel so good. It's a wonderful, wonderful name which you all have chosen. And today I could see all these vibrant, dedicated women with lots of cheers. I mean, I can't overcome that kind of a scene right now, and I always wish that all the best for all future endeavors and whatever progress and whatever love you want to share with women doctor.
Lovely. Thank you so much, ma'am. So without further ado, I'll pass on the baton to Dr. Rukaya for the first segment.
So my first segment, and I take you back to the flashback. So it's the calling from curiosity to commitment. The flashback to the past, which is 5 decades earlier. I was not even born then. So when women would not even commonly chose medicine as a career, how a woman chose such a daunting specialty and stayed put in it for more than 50 plus years. So, ma'am, I would like to know that oncology is one of the most emotionally demanding and complex branches of medicine. Take us back to the very beginning. What first sparked your curiosity towards cancer care, and what has kept you deeply committed to this field over the 5 decades?
Well, but I'll must start with some of my professional journey was full of chances, absolute chances. Then came choices and lots of challenges. Yes, I will have to tell you, go back that since I was a kid, I wanted to be a doctor. And my father was a mentor. And after doing my MBBS, I just decided to get married and be happy forever. And never thought, because even though my dad wanted me to be a gynecologist, I said, no way, I'm afraid to catch babies, you know. So he said, but you will have to do the specialty. But well, I had to drop off surgery, medicine. Only specialty I found that the pediatrics were full of women doctor then, you know. I mean, in all of the specialty, it was a scanty women groups to be seen, you know. So I said, I'll do the pediatrics. I did pediatric surgical post. And here my husband tells me, you're a pampered kid. Why don't you go abroad? You have ECFMG exam in your hands. And explore the world when they are paying for you. I'll join you in 1 year and come back. So I landed there and I was in pediatrics. No plans. It was just by randomly I turned into pediatric residency. And then I saw and I wanted to be a neonatologist. And then, well, they didn't have a post for me because it was occupied for 3 years. And my absolute mentor was Dr. Lipschitz. He says, sorry, Asha, you'll have to pick some other specialty. And here I saw leukemia patients in the department where my new director had joined, and seeing those fantastic challenges of leukemia at that time. We're talking about in 1971. That was the time when I saw a beautiful progress happening in leukemia patients. So I started applying, and I had to tell my husband it's not just 2 years, but I have to do a fellowship, you know. Without that, I'm not returning. And last moment of my post, which I had committed, my husband tells me when we were ready to move to another state, he says that we can't move. I can't leave New York City. I'm an architect. I'll have to work here. I had to drop my post, and I was jobless. And I bumped into Dr. Jatin Shah, and he said, why don't you apply at Memorial Sloan Kettering Cancer Institute for just pediatric oncology? You know, I just picked up the phone and went for the interview and got the job. And rest is the story. The rest is the journey, how I landed in oncology. So it was only by chance, I would say that. But of course, I had a choice which specialty to do. So that's the way I started my journey in oncology. And the oncology, pediatric oncology in Memorial Sloan, it was brilliant. Where the protocols were made, where new drugs were tried, the combinations and new cures. And every disease of cancer at Memorial, I could see. So when it was getting over, my 2 years were getting over for my fellowship. And I said, no, I have to do hematology fellowship to have a board exams and whatnot. I started applying, and then one day I saw 6 patients like a lobsters in the department. I said, what happened to these 6 patients were red like lobsters? And that was the time they told that the patient is having GVH, so graft versus host reaction. The whatever foreign cells were gone in from blood to patient has created havoc and eating away patient cells, and certain area more. And that led me for immunology, transplant immunology. What happens? And I was lucky to have Robert Good, whom I had heard when I was doing pediatric residency that he being a father of T cell and B cell. And when he was giving a lecture, I was getting goosebumps. And I said, wow, I would like to work for 1 year in immunology and go back to India. Well, from 1 year, it did turn out to be more and more. Like from 74, my fellowship, I I did attend to so many years, became a faculty, and I told them that I'm not going to leave the country, And, but it never happens, right? So my husband says, pack up, we're going back home. So in 1980, I landed in India. Sure, it used to be told that when you are in Memorial Sloan, that even in any institute in America, you go down, you will feel that, oh my God, we are in a primitive place, for cancer treatment is concerned. So you can imagine to coming back to India, it was a big challenge, but I had lots of hopes. So that's the way I landed in India. I had a lot of hopes, and I wanted to create mini Memorial Sloan. I think I was maybe mad. I think that madness had been pushing me to do that. And I came back and I started with, I must tell you then, what happens when you say the chances, I happened to bump into my godfather, who became my godfather. Because my godfather says that only you would be successful with so many credentials and so much experience that what are you going to do? So you need to have godfather. 60% depends on godfather. The rest is, whatever you can calculate, But then I joined Wadia Children's Hospital and Harkishan Das Hospital. So that's the way it began. So 7 years, and after 7 years of struggle at Wadia Children, setting up the lab, setting up the department, but was never too happy because nothing we could do under one roof. And as what I wanted the results of Memorial Sloan to be duplicated.
Yeah.
And that's what it is. And then in 1987, I joined Hinduja Hospital. And then I could really develop the state-of-the-art department.
Absolutely, ma'am. You have actually developed a real state-of-art cancer hospital, which was nowhere in the city when Hinduja had it. Right from setting up, like you actually were the one pioneer to build up like the Sloan Kettering that you have been there in terms of how the patient would be received, to the protocols to be set, to even practicing, where the doctors would also get time, not just for the patients, but also for themselves. So that was one private hospital where things were in balance and not the rush that we commonly see with other corporate hospitals that they are running around with. Ma'am, so what is this one thing that you picked up from the US when you came back here and you wanted to put this thing, when you are building up your systems? So whether it was Wadia or whether it was, and especially over here where the resources are much lesser, we were still not as technologically advanced. We did not have everything available over here, which you were already in terms of even medications or tests, both.
So how I navigated?
So what is this one thing which you thought that, this is something I really need to imbibe from, from Sloan Kettering and make sure that this practice is here as well?
So I think I would say that what I could say, what I got from America is that you have to pursue. Complete perfectionist and pursue your whatever you are taking in your hands. So the protocols, protocols, and protocols. That's what I learned from there. You have protocols. You have to know how your protocols are made, how to apply, how to make your team to follow the protocol to T, and no deviation from there. Question asked, modified, rectified. But no, you've got to follow the protocol. And third most important thing I learned was problem solving attitude. If you have a problem, you have to solve it. You can't just drop it. I didn't believe in, or maybe it's me, or even that hospital. I mean, Memorial Sloan made me feel that, it's not possible. That's one thing. And second thing, I tried my best. What do you mean by I tried my best? I mean, that's what you have to question. So that's what, not one thing, many things I learned, but I would just say that that's what is the most important.
Fantastic, ma'am. This has been such honest conversations that we've had here. I would like the next one to take the next segment.
Yes, thank you so much, Rukia. So, ma'am, now after your personal journey, we want real experiences and your practical experiences about leadership and building system of care. As you said just now, protocols, and protocols, but how to make the protocols? As head of medicine and head of oncology at PD Hinduja Hospital, you have helped develop a state-of-the-art cancer care program integrating surgical, radiation, and medical oncology. But what key principles guided you in building the comprehensive care system, including the protocols? How did you do it, ma'am?
So first you ask for a leadership. Yes, you got to be a leader. And quietly, firmly, you will have to see that whatever you have decided to progress towards, it has to happen. So as a leader, I mean, I wouldn't say I was fearless, but yes, I had decided to be fearless. I have to have a conviction. I will have to have a courage of my convictions, otherwise. And I have to be able to execute. So I had to be very disciplined. I was very disciplined because here I had to carry my team and say that the patient has come with all hopes put into one basket and that too given to you. So you got to do whatever you have to. You can't say, I occasionally used to say that, I will allow the mistakes, but I will never allow negligence. In my department, just that cannot be any negligence. You can justify yourself that one, not just justification. You will feel solace that you tried your best, you followed the protocol. Maybe, this patient reacted differently or responded differently or something like that. So as a leadership, you have to be an example. You can't, today, yes, we have a great infrastructure, but when I didn't have a great infrastructure, I would sit and start IV line myself because I didn't want extravasation on the patient because nurses are not yet trained. Till I train chemo nurses, So that was like that. So you have to set the example.
Yes.
And at the same time, yes, you have to be little inconsiderate. You do give some concession to your team members. But one another thing I decided to teach them. You have to teach them better. And just teaching, not just mugging up, but even I had to teach nurses, not only just doctors and paramedicals. And when you have to do that, you have to give them the reason that why we are shaking this medication for 10 minutes. Why? Otherwise, they may cut short and make it for 5 minutes, So unless I always incorporated the why during my education as a leader, but my openness as a leader was still there, that I would be open to find any suggestions, but not always accept it very easily. And but I would be as a leader, I would do that. What was your second part of your question?
Like how did you keep the checkpoints? Like when the principles, like how you were running a big institute or the department, and as you said, the negligence you will not tolerate. So how did you have the reporting system and the checkpoints?
Initially, I was hovering at everybody, because my day would begin at 7 o'clock and it goes on till 7, and still you are available on the phone calls. And if you imagine when phones were not available, I had to go across the street in a hotel and dial the number and talk to people. So I think your goal is you have to achieve, you've got to do whatever you're supposed to do. And I still do feel that as a chief, you still have to have control all over. You have to have a checklist, but that's protocol. But let me tell you, the nurses are very good in following the protocols. We doctors are not so great in following protocols. So that's where you have to check a lot, Yes. And yes, I would try to occasionally make them feel guilty. Sorry to say that, but I would say, if you would be in patient's place, how would you like to be treated? Yes. Do you think you would have liked this kind of lapse? Do you think you missed out in picking up neuropathy? So, I mean, did you examine in detail? So I think those checklists, you yourself, when you go, you pick up they always used to say when Dr. Kapadia comes on the round, that we feel everything is in place, and she will just touch one chart and here you go, there is a problem. Okay. I think you should be like an eagle eye. You should be very sharp.
And ma'am, you have trained many young oncologists and led multidisciplinary teams. As you've told me the checklist, but what other qualities do you find most important when guiding teams through emotionally heavy clinical decisions and breakthroughs? So apart from checklist, how should we make a team, especially in such demanding profession?
If I got you right, that how you create those young doctors' sensitivity towards the work. Yes. See, most of the doctors, when they do medicine, you all, MBBS, we take it, they already have empathy. But, you have to teach them the compassion. Because empathy stops at, oh my God, I feel so bad. And that's it, Okay, you do feel the pain, but what can you do for that pain? So I would try to say that how can you sleep when your patient cannot sleep in pain? He's in pain. You have to see that you do everything possible to relieve the pain, or something like that, So those were the little pokes we do. And second thing, nowadays I'm afraid about young generation is that I do. I mean, I have over so many years, 50 years, I've seen how young generation has changed, and I do feel they are becoming more guidelines follower,
Yes.
and they do not know how guidelines are made. So they do not know, and maybe they do not see in in their teachers that maybe there are no education to create those kind of understanding. So they become like a robot.
Exactly.
They become
They just follow certain guidelines.
Exactly.
There is no
So then they are bored. So when they are working, they are already bored. They already feel it's easy. If even Dr. Kapadia opens the thing and looks at today's guidelines, but where we have a backup of so many years that each one protocol, how to tailor it is very different phenomena. So I wish I make more medical oncologists and not the chemotherapist.
Yeah.
I mean, that's what I feel.
Yeah.
So it's just
So what I could gather from your talk is one thing is protocol is the key when you're leading a team, and you should follow certain disciplines, and when you are leading a team, and empathy as emotion is the key point when you're handling your team and the patients.
so about emotion. When you say that emotions are going to be there, because it's going to be lots of stress of death, dying, suffering, pain,
Yes.
handle. So the students go through it. I went through it. I when I joined the cancer department in Memorial, I went for vacation for 1 month, and when I came back, I saw the patients whom I thought that they will do well, they were dead, and those I thought they were not. On the other side, I found that the patient who was doing so well is suffering now, and suddenly we're losing. And it literally brought tears in me. I was just not salvageable initially. And then the most important thing is that in a high strung emotional place, um, they are having a team of mental health care team. So they have a mental health nurses, they have a psychiatrist, they have a counselor, psychotherapist, everybody. And whole team goes through those process. So they know how to. And if that has to be, we had inculcated in memorials, I mean, at Hinduja also. And we did have a psychiatrist who would take sessions with the doctors every month. But now, as years have gone by, I think that need cannot be there, or as required, it can be taken. But that's what.
Thank you so much, ma'am, for your inputs and sharing. Over to you for the next segment, third segment.
Thank you so much, Dr. Pranjali. And ma'am, beautifully, as you mentioned, that when it comes to empathy and when it comes to compassion, that's a very small shift that one needs to make. But that's the skill you would want, your students to empower with. And this next segment, we're going to talk about exactly that human side, which is compassion, resilience, and patient care. So as just as building blocks, cancer care is much about the people as much as it is about science. And of course, who knows that better than you? And at times, when we say that hope is something that is very essential, or rather the biggest positive one when you think about in cancer patients, that can still be limited given the kind of cancers that are there. And I've heard few of your talks where, of course, a lot of cancers are curable, but then there are some where like assumptions do not work, and as you just stated that we cannot predict everything. So my first question: over your long career, ma'am, you've seen triumphs, setbacks, and losses. How do you sustain your personal emotional resilience while maintaining compassionate care for patients and families?
As I told you, that how I began myself, because your resilience is not genetical, you will have to acquire. So that's over a period of time. So I think every situation, either it was a triumph or even it was a setback, I think one goes through the phase of looking at it, reflecting on it, reacting on it,
Right.
and then you will have to have a philosophy how to deal with it. And you will have to create that philosophy. You can't just say that, oh, forget it and move on.
Right. Totally agree, ma'am.
Yes, you will move on, but you will have to move on without losing your sensitivity. You still
true.
have to be attached to your patient when you are treating, because that's the only way you will give the best. You will have to learn when to start detaching yourself.
Yes.
You will have to learn when to begin with non-together, become non-attached. But then when you are non-attached, then you can still do the job properly. If you can learn that, you would require, whenever any process happens, you have your peer, you have your friends, you have your family.
Yes.
But you do not want just the talk, right?
Yeah.
You want more depth. And you have to spend, brood on it, and then learn to do it. And I think you can. But it's a journey. You have to have someone or something or reading. It could be your friend, philosopher, and guide. Yes, we all have to have that. And your own discipline of a bit of medication. At the same time, yes, you also want to enjoy. You want to see the world. You want to travel. Everything you want to do, I mean, I have been able to do everything in spite of it.
Correct.
So I think you have to develop your emotional resilience and still remain sensitive.
I think it's just an ongoing journey because I had a very brief stint at Raheja when I used to work in the intensive care unit. So I've worked with the oncologist, and I still remember if I think of that time of my life versus now, I guess I used to be involved in every patient so much, and it used to be so difficult for me to detach from them, though I wasn't even the primary caregiver for them. And it made me think at nights, it kept me awake at nights, which is not the case today. Like the patients come for OPDs and they go, and even if they're admitted, they're still, probably not as much as exhaustive for me as much as they were at that point in life where I was actually just one of the trainees. So I guess definitely, yes, it's about detachment and learning as an ongoing process of how to deal with emotions.
Let me tell you, I had a nurse who had been sent to America. I had sent most of the people for training in America to come back, that what I would like them to achieve, rather than getting some foreign nurse and do that thing.
Right.
She used to say, she came one day and complained, Dr. Kapadia, when this patient is not doing well, you start coming, you come less. I mean, your frequency keep on decreasing. Your time spending with the patient is decreasing, That's not done. She comes and tells me, she was a Christian nurse, And it brought me that I myself could not cope, and I had to learn to cope. So there was one thing which my teacher had taught me. Asha, you have followed the protocol. That protocol have gone through testing. It has been successful for most of the patients. Think you did the best for them, but time has come that nature has taken over, and you have to let go.
Yeah. Brilliant learning, ma'am.
I'm sure all of you do that, That's what I did it too.
Yes, ma'am. We're learning a lot from you because, like I said, that it's so many times that we are relating with these things, but probably we still not mastered the art, and it's an ongoing learning process. Also, one quick question that when we look about looking at these difficult diagnoses, as you were mentioning. Sometimes there are cases which you may be seeing as curable, some may be non-curable. So how do you manage these cases or these diagnoses? How do you manage to give the scientific whole truth? Because, you have to obviously not, you know, but strategically also ensure that the patient is not
Let me
very
tell you, you
disturbed.
never tell the whole truth on day one. Never,
Totally agree.
ever.
Yeah. Yeah.
The first thing you have to know, okay, when patient has come to you,
Hmm.
they do have a fear,
Yes.
but they do have hope, right? They all
Yes.
want to live.
Totally.
They all
Yes.
want to be cured.
Totally.
It's really true. As you grow older, everybody wants to live.
Yes.
Whatever hope you give, they want to live.
Yes.
So for the science, what I put it in such a way that, very simple way, I would say that, well, this treatment, what we are going to give, it has been given to thousands of patients, if you treat 100 patients, 70 will do well, 30 will not do well. But you have to just think you are in this 70. That means it's 100% that you're going to
Yes.
do well. If in
Right.
case something happens, we have another treatment available, something else is available, then we will keep on going and keep on fighting along with you. And
Right.
second thing, I think that's the way you tell about the science. But today's time, they come with all homework with AI. It's going to be different scene for all of us. They will have a different question, but I think you will have to tell them truth eventually, and just tell them that you will never abandon them, and promise them that we'll see that you see that they won't suffer. I think those are the 5 things we tell them in a little conversation.
Excellent. Thank you so much, ma'am. So now I'll pass on the baton to the next Dr. Lotika for your segment.
So, hello, man. It's really been very interesting hearing your story. So, now is the fourth segment, which is about vision, legacy, and guidance for women doctors. We all have known you as a doyen in the field of oncology, but as they say, Rome was not built in a day, and so was your legacy. And yet, you continue to write the success story. So, in this segment, we would want to explore what is next in oncology and for women in medicine. So, the question is that with cancer care evolving rapidly from targeted treatments to immunotherapy, what future trends excite you most, and how should aspiring oncologists prepare for them?
For me, immunology, and immunology.
Immunology. Oh, that's right.
That's the most exciting thing.
Okay.
That your own immune system
Mm-hmm.
get rid of cancer.
Okay.
Of course, the cancer cells are smarter. Some may not even respond, and some may become resilient, in spite of it, they would keep growing. But immunology, because today's immunology, it started with transplant, it started with the checkpoint inhibitor, there are CAR T cell treatment. I mean, it's all hopes. And the thing which could have been and will be hopefully is the vaccines, The way how we got rid of polio, right? Infection, right?
Yeah.
Let's see if cancer's infection and we get rid of it, with vaccine. So let's hope that's the journey, and to people to remain updated. The most important way is to read, go to conferences, go to the centers and be observer where things are happening. And even nationally, internationally, all these are available. So how to remain updated, it's up to you.
Okay. Okay, ma'am. So, as a woman leader in a demanding specialty, what advice would you give to young women doctors who want to build both a strong clinical career and a life with balance?
That's my favorite topic. I would say that, but I'm going to just make it short in few lines. Is that, I mean, you all are balancing. I think the most important quick thing is that if you're married, you need to have a very understanding husband. So when you're young, MBBS, or even before, find a man who understands you and never comes in the way of your ambitions. Then comes children, right? The children are very manipulative. They see that, this mother came to drop me at the school and you never come to drop me at the school. Hey, that doesn't work. So you have to talk to your child, explain the reasons, and bargain with him or her, whoever, because they are very manipulative. And the children can live in spite of you. Let me tell you that.
Mm.
So it's you who's guilty. So to young
Very,
women,
very true.
I would like to tell
Mm.
that, never feel guilty, number one. And there is also possibility that there are women who make you feel guilty too, that other mothers, oh, Dr. Asha, how can you, when so much time you're working and now you're going out for a movie, leaving your child with the babysitter. No, that doesn't work. So that's another story that you have to. So the children are the one. The most important, you all have done infrastructure at home and at work.
Mhm.
You have to have your colleagues who can take over in your absence.
Yes.
So if you have a good team of your colleagues who can look after equally well your patient, it gives you freedom. And but never take number of patients if you cannot manage. But because they've come with full trust in you, so, and in spite of today, I can tell you that I had a very understanding, I have a very understanding husband who never came in the way, who's a very well-known architect. I have a son who's a now associate professor. No, he's a professor and he's associate dean right now. And all that in spite of whatever I kept on doing, I think so. I'm an example for you all. I mean, it can be possible. Many of you have done it. But at the same time, somebody will say that you might not have been able to do many things in your life. I have traveled around the world. I've traveled through conferences, so that's good too, because you can see. I have great friends, dancers, filmmakers, and artists. I go to all those shows. I interact with them. I mean, so all these are possible. And the older you get, you require only 5 hours of sleep. Older, younger one may not, maybe. I think this is in short. I feel that, I feel that never feel guilty. Resolve it. But you can balance everything and you can achieve everything. Because I think they say that the women are like Kali, they have so many hands.
Yes.
Wow.
Oh, yes.
Should be able to manage many things.
Yes.
So we are already balancing.
Yes, ma'am. It's always a very difficult balancing act to do, managing patients as well as managing the family and expectations on both sides. But I think you've done a fantastic task with that. So, but looking back at your extraordinary journey, what do you hope would be your lasting legacy in oncology, in mentorship, and the way we care for patients?
I think one would have been that I would love to see cancer cured, but I think it's too smart a cell to be away from. But I would like to see every patient gets tailored treatment and affordable treatment. at the best treatment. It should have a scientific base. It should have a good combination to use at the right time and right way. Example, we have surgeons, if a surgeon is a great oncosurgeon with concept, is different than the one only with technically good, because the scar which this technically good guy will give, maybe it's a wrong scar and you will have a horrible breast, and on other side, you will have a finest scar. So I think the importance of right treatment is very important. The quality. So, but as a legacy, one thing I would have to have that integration of the cutting edge science and profound compassion. As I told you before, you can't be detached. You have to be just not empathetic, but you have to have a compassionate. As a mentor, I feel that you want to have a young generation to feel that it's not me. It's we. You have to have a collaborative work, because then you can do a very good. And we all should have a national protocols and guidelines, which we may not have in all. And at the local level, even in your departments or even in your clinic, it's a simple thing in oncology is a tumor board, which should be the one, could be the future legacy, that each patient gets tailored treatment after tumor board.
That is so nice. It's such a nice thing. So now I hand over to Dr. Kavita Rane for the next segment.
So after the amazing segments, thank you, Dr. Latika. We will move on to something called audience ask, where we take at least one or two questions from the audience. I've got a whole battery of questions, but I'm going to ask you only two questions, ma'am. So the first one is, as an oncologist, how do you stay updated with the latest advancements in cancer treatment?
How to get updated?
Yeah, how do you stay updated? How do you
Stay
help?
updated. Oh, how I
Yeah,
stay updated.
Yeah, how do you stay
Okay.
updated?
So whoever had asked me, let me tell you, today I'm 80 years old. Today means I'm entered my 80 years, not today, but okay, looking after 90 years old advanced Parkinson husband, spending equal time with him, with equal time to the hospital. And 9 o'clock, he falls asleep with all the cocktails we give. And then 9 to 12, I read. That's the way I do it.
Amazing. Amazing. I mean, thank you for that deep revelation of how, despite of the challenges that you face, you literally kept yourself updated. There's one more question that I'd like to ask you. How do you balance the emotional demands of working with cancer patients with maintaining your own well-being and delivering the best possible care?
I think, as you heard, that I have already developed a good resilience for that. I mean, now I'm also medically becoming limited. So otherwise, most important is that you have to go to gym.
Right.
All women should go to gym, because as soon as they will strike the menopause, their muscles are going to be
Austrian
going.
beyond, yeah.
And only thing is not
Yeah.
just the jogging going to work or treadmill at
Yeah.
home, it's the weight bearing exercise. So that's what I did. I had my personal trainer. I still have one, and who would maintain. I'm not so great yet, I mean, now again, I've gone bad. So that's the one thing. Second thing, do meditation.
It's amazing.
Because
I
that's
mean,
the only
stress.
thing will um, give you solace when you have lost lot of dear patients of yours. And because of
I
limited resources, limited availability, some mishaps, whatever it is.
Very true, ma'am. Like what you said, the chaos outside will continue, but the peace needs to remain within. So you need to create and generate the whole thing inside you, and that's one place that we can go. Amazing, ma'am. Thank you so much. And moving on to the next segment, it's called Rapid Fire, ma'am. Here it's so that's the pulse of life, where we are going to ask you questions, and you can
Sure.
give us one-liner answers. Just
Okay.
quick
Quick.
questions. Yeah. Oncology to you in one word.
One word, calling. Now it's my calling.
Amazing. Biggest lesson cancer patients taught you?
Biggest lesson from my patient?
No,
I
cancer patients taught you. What
taught
have
me to be courageous. My
Courage.
God, yes.
Wow. Yes, 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 ma'am. A habit that
I was
keeps
full of fear.
you grounded.
I was full of fear. I became fearless
Yeah. True.
because of my patient.
Fearless. Amazing. True. True. I mean, the level of morbidity in this line
What is
that
the
you
next
have
question? I can't hear
followed
you.
is
You're breaking.
really high. Can you hear me now?
No,
Can you hear
you're
me?
breaking. You're sounding.
Okay. How about now?
Pardon?
Can you hear me now?
Now, yes.
Yeah. So a habit that keeps you grounded.
Perfectionist. Not OCD. Not OCD. Perfection.
Okay.
There's a
Okay, I hear
difference.
you. I hear you. I hear you.
You can hear?
What? Yeah. Yeah, yeah. So, what the next one is, what do you crave for on a Sunday afternoon? A nice nap, a quiet book reading, a movie with loved ones, or a girl gang mashup?
All. 1 week this, 1 week that, 1 week that. All. I
That's
would love
amazing.
hang around with women. I would love to have a great nap. I mean, yes,
Yeah, yeah. So, science or empathy? What leads your clinical decisions?
I would say um, science with art. So it came both.
Okay, creative. Nice. I like that. Women in medicine, one word.
A gift. We are all gifts to to the world of medicine.
I love it. And the last one, ma'am. Legacy you would choose. How would you like to be remembered?
I would love to be remembered like a gold, absolute pure
Here
metal,
you are. You,
malleable at the same
yeah.
time, strong. I would like to be like a diamond. No way. I just don't want to just spark. No. Only like a
Amazing.
gold.
That's the first time I've ever heard anyone say that. But precious metal, amazing. I love it. Over to doctor. Over to the next doctor. Thank you.
Thanks so much, ma'am. It has been such a pleasure to hear you. And this today's conversation, it just reminded us that oncology, yes, it's about protocols and it's about precision, but more importantly, it's about the courage, the compassion, and the consistency that you bring. And we heard that Dr. Asha Kapadia has showed us how this science and humanity can coexist beautifully in clinical practice. Thank you, ma'am, for reminding us that healing goes beyond treatment and impact goes beyond outcomes. So this is exactly, why the vibe exists. It is to learn from this woman like you who lead with purpose. It's been so wonderful to have you here today. And like all of us will tell what has been our learning from your conversations. And my learning from today's conversation is never feel guilty. I'm going to take this. Not feel guilty about what you're doing. Just own it up. It's amazing. Ritu, what has been your learning?
Rukia, you will have to say it again. I could hear you. Where were you?
So, ma'am, I said the one thing. So we are all going to say about what we learned from today's conversation.
Okay. Each one of you going to talk. Okay.
Yes. So for me, what I learned was, yes, empathy is inbuilt because we became doctors, but compassion is something that you teach yourself along the way. And very important, never feel guilty. Ritu.
I think, ma'am, I really love the way you were talking about, the relationship and the learning that you've also put in during the entire journey. The way you said patience made you fearless. You also, talked about detachment because, of course, when you're working, there is science, but there is also the fact that how strategically you need to envelop the data that you want to share, the information that you want to put across to the patient, what is important for them, how they digest the story, and how you still hold their hands during their journey in this particular, diagnosis, whatever type of cancer that they may have. So I think definitely, yes, looking at that, I think I want to learn that kind of understanding of how to build yourself, still have resilience and grit, but also be able to shoulder the responsibilities of the patient and connect with them. Brilliant.
So for me, it was like since I'm learning internal operations and handling team building in the hospital, for me it was protocols, and you modify, rectify, but you need to follow the protocols. And that is the key when you're handling the internal operations and team building. Thank you so much, ma'am. Kavita.
So, ma'am, you said everyone needs a mentor. I really can connect with that. And mistakes are allowed, and negligence is not. This is the other thing you said. So, when you've got a mentor, you have someone to open up to ask, to they can suggest to you from their experience. And I love that part of what you said. And so thank you so much. And all these you're on the screen are my mentors. So I love that I can relate to that part of it. So thank you, Dr. Latika.
So, yes, protocol. And what I liked was that first you have to understand how the protocols are made and then see to it that the team follows it to the T. Which though, I mean, we do have protocols, but a lot of times they are not followed. Also, what was important for me is to have the problem solving attitude, because problems will happen, but you have to have the attitude as to how to solve these problems. So, madam, this was really very inspirational for all of us to hear all your about your journey and the sharings that you did about this. Now I'll hand over to Dr. Rukaiya for the closing.
Yes. So, ma'am, with this, we come to an end to our vibe session. And your journey has reflected the resilience, the quiet leadership, and the deep compassion, the qualities that define that not just as a great oncologist, but a remarkable human being. And thank you for sharing these insights with us that stay with us long after this conversation ends too. So with this, we end. And while we end, we come to the signature where we put our we together and we call on the count of three, be the wild. So ma'am, both your hands, yes. And on the count of three, Kavita, are you ready? We can't see you in the camera. Yes. So 1, 2, 3.
Be the
Be the vibe.
Ma'am, how was your experience now at the end of it?
Thank you.
Thank you. Thank you so much, ma'am, for being here today.
It was lovely.
Thank you so much.
Thank you.
Thank
Thank you, ma'am.
you.
It was really very
Bye.
nice talking with you. Thank you.
Thank you, ma'am.